Hello, my name is Olubukola Toyebo, and today I'll be presenting my research on healthcare in Nigeria as it relates to my Health Policy and Administration course on Comparative Health Systems. Nigeria is a West African country on the Gulf of Guinea, bordering Benin, Niger, Chad, and Cameroon. Nigeria gained its independence from the United Kingdom as a Commonwealth realm on the 1st of October 1960. This is Nigeria's national flag. The two green stripes represent Nigeria's national wealth, while the white band represents peace. Nigeria is Africa's most populous country. It's composed of more than 250 ethnic groups. The most populous and politically influential are Hausa and the Fulani, then the Yoruba, and then the Igbos. Nigeria's official language is English. However, Hausa, Yoruba, and Igbo are also spoken, and Fulani, as well as over 500 additional indigenous languages. About 50% of the population is Muslim, 40% Christian, and 10% indigenous beliefs. Nigeria has a gross domestic product of $568.5 billion, with a health development index of 0.504, which is about almost half of that of the United States. This low health development index could be due to the 3.9% of the gross domestic product spent on health expenditures. Nigeria is also a very religious country, whereby subjects like sex is still taboo, which limits access to informing citizens on healthcare and public health. Black magic, voodoo, and witchcraft are still practiced in villages and rural communities. And health personnel are still go on strikes during critical periods, such as before the Ebola outbreak last year. There is still inadequate water and sanitation and energy available to Nigeria's population. Nigeria has a population size of over 177 million individuals, which is just about half of that of the United States. Has a dependency ratio, a high dependency ratio of 87.7%, with a median age of 18.2 years and a life expectancy of only 52 years. Nigeria has a population growth rate of 2.45%, a birth rate of 37.64 births per 1,000, which is triple that of the United States, a total fertility rate of 5.39 children born per woman, and an infant mortality rate of 72.7 deaths per 1,000 live births, which is about 14 times that of the United States, and a death rate of 12.9 deaths per 1,000. The high birth rate and high total fertility rate could be due to the low contraceptive prevalence rate of 15.1%. Now to focus more on Nigeria's dependency ratio, which is very high. And this high total dependency ratio indicates that the working age population, which is very small in Nigeria, and the overall economy face a greater burden to support and provide social services for youth and elderly persons who are often economically dependent. This can be shown here on Nigeria's population pyramid. The shape of the population pyramid gradually evolves over time based on the fertility rate, which is twice that of the United States, the mortality rate, which is 14 times more than that of the United States, and the international migration trends. As mentioned earlier, Nigeria has an infant mortality rate of 72.70 deaths per 1,000 and a death rate of 12.90 deaths. And as this relates to the epidemiological analysis, the top 10 causes of death in Nigeria is at number 1, malaria, then low respiratory infections, then HIV, then diarrheal diseases, and at number 5, road injuries, following protein energy malnutrition, cancer, meningitis, stroke, and at number 10, tuberculosis. Malaria could be Nigeria's #1 cause of death because of the placebo or expired drugs in pharmacies given to the population. So individuals think that they're being cured for malaria when they're actually taking ineffective drugs. Nonetheless, Nigeria's Global Initiative Strategy has a plan with their goal to improve healthcare status of Nigerians, with their expected impact to reduce maternal, neonatal, and child mortality and morbidity, and to decrease unintended pregnancies, with their short-term outcome to increase access to, demand for, and quality of health services, and their long-term outcome to increase utilization of quality public and private sector health services, as well as increased adoption of healthy behaviors. Nigeria's health providers go through a similar educational journey to that of the United States, whereby they pursue a secondary education and then they attend college and take mainly science courses, which is the equivalent of the last 2 years of high school in America. And then they take an exam similar to that of the MCATs, which for the United States of Nigeria, JAM. And then after achieving the required scores, they then matriculate into medical school or nursing school. In Nigeria and the United Kingdom, medical school is 6 years. And then after the completion of medical school or the health professional schooling, they can then go on to internships and specialty training. There are 0.4 physicians available per 1,000 of the population, which is very small compared to the median OCE recommendation of 3.3 doctors. There are only 0.53 hospital beds available per 1,000 population. Nigeria has many healthcare facilities and organizations. There are private and public hospitals and long-term healthcare facilities. I had the privilege of visiting a private and a public hospital. The private hospital I visited was the Reddington Multi-Specialist Hospital, which is a tertiary hospital which was established in 2001, with different specialty departments in cardiac care, intensive care, pediatrics, and others. It is associated with Cromwell Hospital in London. I visited Lagos University Teaching Hospital, LUTH, as well, which was established in 1961. It is a hospital, has a College of Medicine, a College of Nursing, and a School of Midwifery. Nigeria also has private long-term care facilities, orphanages, and a federal neuropsychiatric hospital. As mentioned earlier, Nigeria only uses 3.9% of its gross domestic product in health expenditures, which isn't a lot of money, and hence a lot of the population has to pay out of pocket. However, some citizens are able to pay through private insurances provided through their employers, such as Bupa at Shell or Chevron. Nonetheless, Nigeria also has a national health insurance scheme, which is mainly for government employed personnel, whereby the premiums make about 15% of an individual's basic salary, with the employer contributing 10%, while the employee pays 5% for coverage of themselves, their spouse, and up to 4 children. And lastly, my recommendation to improve Nigeria's healthcare would be to move towards expanding the national health insurance scheme to all citizens of Nigeria, and to focus on targeting individuals who do not have access to the insurance scheme, or like hospitals, such as low-income groups, young people, and individuals in rural communities, as well as to focus on public health education and family planning to reduce maternal, neonatal, and child mortality and morbidity, as well as to decrease unintended pregnancies. And lastly, to improve the water and sanitation, latrines, and to work on sewage treatment systems. This concludes my presentation for today.